Okay, here I'm going to go over some very common respiratory diseases, starting with chronic pulmonary obstructive disease, or abbreviated commonly COPD. This is exemplified by chronic bronchitis and obstructive emphysema. Patients typically have a history of smoking, dyspnea, coughing frequently. Dyspnea, again, as labored breathing occurs and progressively gets worse. Overall, COPD victims develop respiratory failure accompanied by hypoxemia, carbon dioxide retention, and respiratory acidosis. How does this actually occur? What's occurring in these individuals? If we look at normal lungs and the alveoli, we see a very high amount of surface area, which is important to allow this gas exchange. Those individuals with COPD, we notice those alveoli are destroyed, forming fewer but larger structures here. This limits or reduces the amount of efficient transfer of gases that can occur. As a result, you can get all of these negative symptoms that do sadly plague this particular individual. Moving on from COPD, we have asthma, something you might be familiar with, typically more common in children than adults. It's characterized by shortness of breath, wheezing, and chest tightness. Acute inflammation of airways proceeds to bronchial spasms. So what's actually occurring in asthma is our normal pathway for air is quite large. In asthma, we have this constriction that's occurring. Could be thickening of the airway wall, could be the constriction, could be the presence of mucus. All of these can lead to asthma-like symptoms. This could be caused by an immune response, this airway inflammation, caused by the IL-4 and IL-5, which stimulate antibodies and recruit inflammatory cells. Airways thicken with inflammation mucus and magnify the effect. This is typically thought of, if you want to try to replicate this or simulate this, would be like instead of breathing through a normal airway, to breathe through a very thin and small straw. You're restricting the ability for air to come in and also for air to come out. You see the current asthma rate and prevalence by age, sex, and race and ethnicity. So by age, child is more likely to become affected than an adult. Females, for whatever reason, are more likely than males. And compared to whites, blacks, and Hispanic races, black tends to be a little bit higher than both Hispanic and white. Inhalers are common ways to reduce the short-term effectiveness of having this potential issue occur. Lung cancer is another, sadly, respiratory disease. It accounts for about 1/3 of all cancer deaths in the United States. 90% of all patients with lung cancer were at once smokers. There's 3 common types, and these all fall under the category of lung cancer. There's squamous cell carcinoma, there's adenocarcinoma, small cell carcinomas. Not going to get too much into specifics, but simply what's occurring here is we have our nice healthy lungs, and we have our affected lungs with smoke, and this is increasing the rate or the chance dramatically of contracting lung cancer. If you look on the packets of cigarettes, they do warn you about smoking can cause lung cancer. In addition to lung cancer, it's also heart disease and many other sadly negative effects. So the question comes up commonly about what about e-cigarettes? So we all know that the traditional smoking has those warnings. What about e-cigarettes? Because they're smokeless tobacco and water pipes and may cause serious potential health problems though. This can include cancer because of the chemicals and toxins that they contain. There's actually currently an active e-cigarette lawsuit for lack of a cancer warning. Because of the potential health risks, the U.S. Food and Drug Administration, we know them as the FDA, has started regulating these products like other tobacco products such as cigarettes on August 8th of 2016. Instead of burning tobacco, they generally contain cartridges filled with nicotine and other chemicals, and just because it's not an actual smoking or burning of a potential leaf or other product, there is cancer-associated risk. You're welcome to check out the links I provided you with to kind of stress some of the point of some of the potential risks with e-cigarettes. Lastly, looking across the country at lung cancer incidence, the above map shows lung cancer incidence in the United States. You can see the region here in the south tends to have a little bit higher incidence of lung cancer. There's a lack of uniformity in the population percentages that smoke, and this suggests there may be other environmental factors to consider. Most carcinogens are also mutagens. So while smoking can increase your lung cancer chance, there's not necessarily a direct correlation. There's some other factors also playing into that. However, when we look at this data, Looking at our cigarettes smoked and our lung cancer deaths, we do see a definite correlation. After the incidence of smoking began to increase in the United States, so did the incidence of lung cancer. Cigarette smoke contains these powerful mutagens. Benzopurines bind to 3 sites of the p53 gene. These mutations at these sites activate the gene. Research has found that the p53 gene is activated in 70% of all lung cancers. So this is showing this correlation here. And nicotine in cigarette smoke is also a very addictive drug, so you can have other negative side effects. The important thing to look at this graph, or at least to kind of give hope for the future, is that while cigarette smoking did increase, then did lung cancer deaths. We notice a decrease in cigarettes being smoked and a decrease in lung cancer. Keep in mind that e-cigarettes are also have their potential cancer risks. So just because you're not smoking a traditional cigar or cigarette, there's also cancer risk associated with those.